Good afternoon and welcome to the webinar on the Office of Medicare Hearing and Appeals, or OMHA, Settlement Conference Facilitation Pilot. Today's webinar is co-sponsored by the Alliance for Home Health Quality and Innovation and the Visiting Nurse Associations of America, or VNAA. My name is Cherise Neville, and I'm the Executive Director of the Alliance. By way of background, the Alliance was founded in 2008 and is dedicated to the mission of leading and supporting research and education on the value that home health care has to offer to patients and the healthcare system. VNAA is the national association that supports, promotes, and advances mission-driven providers of home and community-based healthcare, hospice, and health promotion services to ensure quality care for their communities. Today's webinar is intended to provide an overview of the OMHA Settlement Conference Facilitation Pilot, which is designed as an alternative dispute resolution process for Medicare claims. OMHA's administrative law judges resolve disputes involving coverage and payment issues under the Medicare Act and regulations. We're extremely fortunate today to have 4 guest speakers from OMHA. The Honorable Judge Moore was appointed Deputy Chief Administrative Law Judge for the Office of Medicare Hearings and Appeals effective November 6, 2011. In this capacity, he serves as the alter ego to Chief Administrative Judge Nancy Griswold, OMHA's agency head, and presides over the second largest federal administrative adjudicative system in the nation. Cherise Neville is Senior Attorney and the Settlement Conference Facilitation Program Coordinator at the Office of Medicare Hearings and Appeals headquarters in Falls Church, Virginia. As a senior attorney with OMHA, Ms. Neville serves as a legal advisor to OMHA senior executives regarding administrative law and policy. Additionally, Ms. Neville was instrumental in developing the SCF pilot initiative and currently coordinates nearly all aspects of the SCF program. Carla McGregor has over 17 years of federal government experience within the U.S. Department of Health and Human Services on a wide variety of matters. She serves as the Deputy Director of the OMHA Field Operations Division and is assuming responsibility and oversight of a number of special initiatives, including the Settlement Conference Facilitation Pilot. Last but not least, Amanda Axeen currently serves as the Director of OMHA's Program Evaluation Policy Division. In this capacity, Ms. Axeen coordinates OMHA's development and implementation of appeals policy and supports the agency's continued efforts to address its workload challenges. So, just a few housekeeping notes before we get started. First, Judge Moore will provide some introductory remarks, and then Cherise will speak for approximately 30 minutes, and we'll leave the balance of the time to answer any questions. Please note that this is a webinar, and we control the slides on our end, so don't be surprised if you in the audience are not able to flip ahead. Second, your lines will be on mute. You can submit questions to be answered during our Q&A period through the webinar chat box on your computers or other devices. And finally, we will be making the slides available to participants after this webinar. They'll be available publicly on the Alliance's website, and we are also recording the webinar and we'll make the playback available as well. So without further ado, I'm going to turn this over to Judge Moore to provide some introductory remarks. Judge?
All right. Thank you very much. Good afternoon for folks on the East Coast, and good morning for the rest of the country. I'm pleased to be here today to introduce OMHA's Settlement Conference Facilitation Pilot Initiative. Settlement Conference Facilitation is a program that uses mediation, a form of alternative dispute resolution, to assist appellants in the Centers for Medicare and Medicaid Services, CMS, in arriving at a mutually agreeable resolution for all of an appellant's pending related appeals. 2 or more individuals from OMHA are present during the settlement conference and function as neutral third-party facilitators. However, the parties to the negotiation are the appellant and CMS. If an agreement is reached between the parties, the appeals subject to the agreement are withdrawn from OMHA's docket. This pilot program is one of our most successful initiatives and has been expanded to include most of Medicare Part A and B appeals pending at OMHA. We will detail some of the more important aspects regarding the requirements and processes of the pilot, but first I want to give you an idea of why this particular initiative is so important to our appeals process. OMHA's appeal receipts have increased sharply in recent years. Of course, some of this growth can be attributed to the Recovery Audit Program, but it is certainly not the whole story. We have also experienced significant increases in appeals in our traditional workload for several reasons, including additional post-payment audits being conducted by a number of CMS contractors to ensure program integrity, more active Medicaid state agencies seeking Medicare reimbursement for services that were initially billed to Medicaid, an increase in the elderly population of the baby boom generation, and an increasing number of beneficiaries who qualify for Medicare on the basis of disability as a result of Social Security disability decisions. As our workload has increased, so have the number of decisions our judges have been issuing. We are very proud of the increased output of our judges and their staff, yet notwithstanding the tremendous effort of our judges and their teams to produce high-quality work at an increased rate, our adjudicatory capacity has simply not kept pace with the increased receipt levels. OMHA is committing to addressing our present and future workload from multiple angles, following Secretary Burwell's three-pronged approach. First is to request additional resources. Increased appropriations in recent years has added some additional capacity and allowed us to open new offices in Kansas City and Seattle, which will open later this year. However, it does take time to open new offices, hire and train administrative law judges. The second is proposing legislative reforms. Additionally, legislative proposals found in the President's budget, many of which have made their way into the AFFIRM Act, which is pending in the Senate, would provide additional authorities which would allow us to handle our workloads more efficiently. They have the potential to affect future requests for hearing at OMHA, but they do not decrease OMHA's pending workload today. Finally, take administrative actions within current or slightly increased budgets. This is the third piece of the department strategy and a very important one, and it involves taking administrative actions to resolve pending appeals. That is where settlement conference facilitation comes in. It is an administrative action taken within current authorities and current budgetary constraint, which addresses and works to reduce our pending workload. It allows OMHA to use the expertise and skills of the existing staff to supplement its output. To date, the pilot has removed 8,258 appeals from our docket. This represents the decisional output of more than 8 ALJ teams working full-time for an entire year. And all of this was accomplished with a portion of our senior staff working part-time on this initiative. The merits of this pilot are not only in the number of appeals resolved through the process, it also reduces our pending workload without requiring the attention of our administrative law judge corps. Thus, our judges can spend their time conducting hearings and issuing decisions for those appeals that are ineligible for the pilot or for those appellants who are not interested in pursuing alternative dispute resolution. Another important aspect of the pilot is that it efficiently resolves appeals subject to the settlement agreement and spares both the appellant and the department further adjudication expense. We are very mindful of the Departmental Appeals Board's limited resources and adjudication capacity as well. So appeals resolved through settlement conference facilitation will not add to the Departmental Appeals Board's appeals receipts and pending workload. So that gives you just a few reasons why we are so very excited to present this pilot as an opportunity for the appellant community. Every day we continue to see greater success with this program, and we encourage you to seriously consider the pilot as a means for resolving your pending appeals at OMHA. Now I would like to introduce our OMHA staff who will explain the requirements and processes of our settlement conference facilitation pilot program. First, we have Carla McGregor. Carla is the Director of our Special Initiatives and Deputy Director for our Field Operations Division. Amanda Axeen is the Director of our Program Evaluation and Policy Division. And joining Carla and Amanda is Cherise Neville. Cherise is a Senior Attorney in our Field Operations Division and serves as the OMHA Settlement Conference Facilitation Program Coordinator. Cherise will join Amanda and Carla in answering your questions, and she will also now present some specific information on the pilot. I thank you for your time and interest in this initiative. I will now ask Cherise to present additional information on our Settlement Conference Facilitation Pilot Program. Thank you all very much.
Okay, there we go. Thank you, Judge Moore. Good morning, everyone, everyone on the Central and Pacific and Mountain Time. Good afternoon to everyone at Eastern Time. My name is Cherise Neville. I'm a Senior Attorney here at the Office of Medicare Hearings and Appeals in the Office of Operations. Before we start, I just want to apologize in advance. I'm a little bit congested today, so if I sound a little bit off, just please bear with me. Today we're going to go through, very briefly, some of the more important aspects of the Settlement Conference Facilitation Pilot Initiative here at OMHA. And so to begin with, we're going to start with what exactly is Settlement Conference Facilitation. Well, Settlement Conference Facilitation, or SCF, which is what we call it for short, is an alternative dispute resolution process, and it's designed to bring CMS and the provider together to discuss the potential of a mutually agreeable resolution. If a resolution is reached, then the settlement conference facilitator or mediator will draft an agreement at the settlement conference, and we'll talk a little bit about that later. As part of the agreement, the request for an administrative law judge hearing for the claims covered by the settlement will be withdrawn and dismissed here at OMHA. So you may be wondering what a settlement conference facilitator does, or who is the settlement conference facilitator? Well, your facilitator is a specially trained employee of OMHA. Your facilitator is neutral. That means that your facilitator has no vested interest on your side or on CMS's side. We are truly a neutral party here to facilitate a discussion between you and CMS. Please note that the Office of Medicare Hearings and Appeals is a staff division of the Office of the Secretary for the Department of Health and Human Services, and CMS is an operational division of the Department of Health and Human Services. OMHA is not part of CMS. CMS is not part of OMHA. Both organizations are organizationally and functionally separate from each other. So your facilitator, which is an OMHA employee, would be a neutral in the discussion. So what exactly does the facilitator do? Well, our facilitators here at OMHA, as I mentioned before, are trained as mediators, and they use mediation principles to assist both parties in working toward a resolution. Most important, though, is what the facilitator does not do. Your facilitator is not an administrative law judge, so the facilitator will not make determinations on the merits of the claims at issue, and the facilitator will not serve as a fact finder. If you are looking for someone to make rulings based on the law or policy regarding how the law and policy should be applied to your claims, and you really want that formal process, then SCF is not the venue for you. You should keep your appeals in the ALJ docket for a hearing. But if you're looking for a payment negotiation process to resolve your appeals pending at OMHA outside of the ALJ hearing process, then we do urge you to consider settlement conference facilitation. So briefly, we're going to review some of the more important eligibility requirements for SCF. We do want to note that the requirements reviewed today are not the only conditions necessary for SCF. So we encourage you to visit our website at hhs.gov /OMHA to see the full list of SCF eligibility criteria. Today we are focusing on Phase 3 of the SCF expansion, which opened this pilot program up to most Part A providers. SCF is also open to Part B providers and suppliers under Phase 2 of the SCF expansion, but today we're only going to review the SCF eligibility requirements and process as it relates to Part A providers. So to provide a little context, several of the eligibility requirements that we have are due to OMHA's limited resources. We are providing this pilot using our existing resources, so we must ensure that there is no duplication of efforts from other pilot programs or legal proceedings. So the very first eligibility requirement is that the appellant has to be a Medicare provider or supplier, and that's simple enough. An appellant is defined as a Medicare provider or supplier that has been assigned an NPI number, and I think most of you are familiar with NPI numbers. We want to stress that all Part A provider types are eligible to request participation in OMHA's SCF pilot, and that does include acute care hospitals. There is an exception regarding acute care hospitals that have claims that were eligible for the CMS Part A hospital appeal settlement option, and you can see that exception there. I'm not going to dwell too much on that because I don't think we have a lot of hospitals in attendance today. I do want to note that organizations that are legally affiliated with each other but maintain separate NPI numbers can be basically consolidated into the SCF process. You would just fill out one expression of interest with all of the NPI numbers that you want included into into a settlement conference. Now, it may be that logistical considerations require that the conference be broken up, perhaps to better deal with all of the claims that are part of all of those NPI numbers. But you can, for example, if you are an organization that has 50 different home health agencies in each state, and they all have a different NPI number, so you have a total of 50 NPI numbers, you can put all of those on an SCF expression of interest, and I'll talk about the expression of interest later. So a request for hearing, your appeal that is pending at OMHA must be for a request for hearing that is appealing a Medicare Part A quick reconsideration decision. And I really want to hone in on that word decision. If you are appealing a quick dismissal, then that appeal is not eligible for SCF. Only appeals that are appealing a quick unfavorable decision or partially favorable decision would be eligible for SCF. Of course, the claims have to be covered under Medicare Part A law and policy. And then finally, well, on this slide anyways, the beneficiary must not have been found liable after the initial determination or participated in the quick reconsideration. And I really want to stress this because a lot of appellants have problems with this eligibility requirement. It does not matter if you disagree with the fact that the quick found the beneficiary liable or your redetermination decision found the beneficiary liable. All that matters is that those decisions state the beneficiary is liable. And if those decisions that you're appealing state the beneficiary is liable, then that appeal is ineligible for SCF. So we really want you to understand that, and also understand as we go through these eligibility requirements that it is you as the appellant, it is your responsibility to ensure that all the claims that will be subject to a settlement agreement are actually eligible for SCF. It is not OMHA's responsibility to ensure that is the case, and it is not CMS's responsibility to ensure that is the case. It is you, the appellant's responsibility, because these are your appeals. So you really want to make sure that you work with us to make sure that all of the claims on there are eligible for SCF, because if there is an agreement and those claims, there are claims on there that are ineligible, CMS will not pay them. So it is to your benefit to ensure that you confirm that everything is accurate. So this is another eligibility requirement that sometimes people get a little bit confused with. They both deal with amount and controversy, although slightly differently. So the first one is that each individual claim must be $100,000 or less. Note that the word individual is bolded and underlined because that literally means the individual claim, not the total amount of the claim. So if you have 5 claims, or, well, not in this case, it would be at least 50 claims, and they're each $100,000, you're good. You're still eligible for SCF because we're looking at the individual claim amount for this requirement. And just to give you some background, this is a statutory requirement. There's no exceptions to this rule. We don't have the authority to grant any exceptions to it, and neither does CMS. Now, I just said all of that, that we're looking at the individual claim, but there is just one slight caveat, and that is if you are appealing an overpayment determination that was calculated via an extrapolated statistical sample. This does not apply to most people. Those people who it does apply to, you do know who you are. So if you have an overpayment determination that was derived from an extrapolated statistical sample, and your overpayment determination amount is over $100,000, then all of the claims in the sample, and in fact all of the claims in the universe, are not eligible for SCF. That sort of look at the claims is only applies to those who are appealing an overpayment determination derived from an extrapolated statistical sample. Now, we move on from that and looking at the individual claims. Now we're going to look more to the totality of the claims. And you must have at least 50 claims pending at OMHA that are eligible, and the total amount of those claims must be at least $20,000. So some appellants have organizations that are affiliated with each other, and perhaps their organization in Maryland only has 10 claims pending, but their organization in New York has 40 claims pending. Well, if you put the NPI numbers down for your affiliated organizations in Maryland and New York on one expression of interest, we will add all the claims together for all of those affiliated organizations, and of course it comes to 50, and if the amount in controversy for all of those claims was at least $20,000, then you would move on in the SCF process. And finally, we want to stress that you cannot complete the request for SCF form or the SCF agreement of participation until you receive a settlement conference facilitation preliminary notification. And one of the reasons why I want to stress that is because, unfortunately, some appellants do not understand this, and I have received requests for SCF forms and along with their completed agreement of participation, but they haven't filed an expression of interest. So the only way you can even get a preliminary notification is you first have to file the expression of interest to initiate this process. So now that we're talking about the process, let's look at that a little bit more in depth. So how this usually starts is that the appellant will submit an SCF expression of interest. And that expression of interest will request OMHA run a preliminary report of your pending appeals and initiate the SCF process. The preliminary report is something that is very basic. You do not receive it, and you will not receive it. So please do not ask us to run appeals just because you want to know what appeals you have pending here at OMHA. We will not do that. So the preliminary report is for our purposes, and it's also so that we can send some very basic information to CMS, let them know that you're interested in participating in settlement conference with them, and CMS will get this very basic report. They'll review it, and then they will decide if they would like to participate in SCF with you. Now, you may be wondering why we give CMS an opportunity to participate or not. Well, every party's time is valuable, and there is a preference to giving all participants the opportunity to respectfully decline participation at their earliest convenience. Notwithstanding, any party may decline to participate at any time during the settlement conference process. Pilot participation is not mandatory, for any party. So we're going to go through the positive track here and assume that CMS has stated that they would like to participate in settlement conference with you, the appellant, which is great. So once we receive CMS's response that they would like to participate, we will then complete an SCF spreadsheet for you. And that spreadsheet will contain nearly all of the information regarding the claims that we think may be eligible for SCF that are pending here at OMHA. If you go to our website, you'll see a sample of that spreadsheet. It has a lot of data points on it, and it is listed by claim, not necessarily by appeal. So some appellants can have hundreds, if not thousands, of claims and appeals on there. But we do encourage you to go to our website and look at that spreadsheet so you can have an idea of what it looks like. Excuse me. So once we run the spreadsheet and we have that ready, we will send you an SCF preliminary notification, and the notification will also have the spreadsheet with it. Once you receive that notification, you will have 15 calendar days to file a complete SCF request package. So what is the SCF request package? Well, it's three things, and you send this back to us within 15 days of receipt of the notification. The SCF request package is your request for SCF form, which you will complete, and the SCF agreement of participation form, which you will also review and complete and sign, and then a completed SCF request spreadsheet. So the spreadsheet that we send to you is not complete. First of all, it hasn't been confirmed by you. So you need to go through each claim on the spreadsheet, ensure that it is eligible for SCF and that the information on there is correct. But also on the spreadsheet, there are these yellow columns, and there's data points that OMHA cannot provide for you. This is information that you, the appellant, have to provide regarding each claim that's on the spreadsheet. OMHA cannot provide that information for you, and CMS cannot provide that information for you. It is your responsibility to provide that, that information. So we do understand that the amount of information on the spreadsheet may appear to be overwhelming when you receive it. However, nearly every appellant, and I really mean, I think it's like 99.99% of all appellants, have been able to provide this data. Further, all of this information is utilized by CMS and its contractors for their review, but also to effectuate settlement agreements. So it is necessary that all of the information is completed in accordance with the instructions on the spreadsheet. Please note that, again, we do not have access to that appellant-required information, and we cannot and will not complete it for you. Now, let's say you receive your preliminary notification, which has your spreadsheet, and you're going through the spreadsheet, and you see a claim there that you're like, well, that HIC number associated with that claim is incorrect. Or, you know what, we got paid on that. You know, it shouldn't be there anymore. That does happen. Or maybe you think there are claims that are missing. You know, you think that, hey, there's 15 claims that should be on this spreadsheet, and they're not there. Do not take action, unilateral action on your own, to take claims off or add claims to the spreadsheet. Please just call us. There is a phone number on your preliminary notification that tells you who to call if you have any questions or concerns about your spreadsheet. We are very responsive. We are very friendly. We will help you to correct the spreadsheet and assist you, because we don't want there to be an agreement and then the claims are incorrect. That's bad for everybody. So just call us. We are here, and we are very responsive, and we will work with you to make sure your spreadsheet is accurate. So once you've reviewed the spreadsheet, you've added your data points that you're responsible for in those yellow columns, everything is confirmed, you called us and told us that, you know, maybe something shouldn't be there, and we worked it all out. So you submit your SCF request package, which has all of your forms completed and your completed SCF spreadsheet, and we receive it here in Falls Church. and everything is ready to go. So once we get that information and everything is confirmed, we will send you a confirmation notice, and we'll also send that to CMS, letting both parties know that we're ready to proceed. And at this point, actually, everything moves pretty fast. We'll get into more what happens after this. But I do want to note that if there are a large number of claims on your spreadsheet, then OMHA, when we send your confirmation notice, you'll get that spreadsheet back. But you'll also notice that there's a new tab on your Excel spreadsheet, and it's called Selected Appeals for FCF. Basically what that is that OMHA has randomly selected a handful of claims that will be the subject of review by both parties. The selection of these claims is to facilitate a productive and focused discussion between the appellant and CMS. I want to stress that this is not a statistical sample. A lot of times people hear random and select, and they think sample, and then everybody gets afraid. We're not doing that. This is not a sample. It's just a random selection so that both parties are reviewing the same thing and we're all on the same page when we come together at the settlement conference. So next, we will have the pre-settlement conference call. That's usually scheduled about 4 weeks after your confirmation notice has been issued. And at the pre-settlement conference call, that's really a logistical call. It's, you don't have to be afraid of it. You don't have to come with your briefs and ready to discuss claims. And in fact, we really don't ever do that in this process. That's not what this venue is really for. But it's all logistical. It's to go over housekeeping items and inform you of what to expect at the settlement conference, and also to schedule your settlement conference. I mean, you're almost done. You've come so far at this point. So it's really just a logistical conference to get things organized for the actual settlement conference. And then we will schedule the settlement conference there, and then we will actually have the settlement conference depending on how things, what things are decided between you and CMS. At the pre-settlement conference call, the settlement conference is usually scheduled 2 to 4 weeks after the pre-settlement conference call, and then that range, it depends on if you submit position papers or other issues. So at the settlement conference, we do want to reiterate that the settlement agreement, if there is one, and most of the time there is, so I feel confident that if you come into this process with realistic expectations and an open mind, you can get a settlement agreement. So if there is a settlement agreement, you have to note that that the settlement agreement must be signed at the settlement conference. Due to the nature of this pilot, you will not have the opportunity to take the agreement home for several days or weeks and sort of mull over it. That's not what this is. You do have to decide at the conference whether you will come to an agreement with CMS. To that end, you can review a copy of the settlement agreement template on our website. We want to note that the template has been vetted by multiple federal agencies for use with this pilot program, and the standard terms will not and cannot be altered. One other thing I want to note is that in this pilot, payment is negotiated based on a percentage term. It is not based on an actual dollar amount. So typically, and I'm just throwing a number out here, if there's an agreement and let's say both the appellant and CMS agree to 65%, it's 65% of the Medicare payable amount. That's what is agreed to. It's not $500,000 or something like that. It's a percentage term. It's not an actual dollar amount term. So keeping with the positive track, if you've gone to the settlement conference and you have an agreement that you and CMS have both signed, which is great. So now the agreement is fully executed. At that point, after the conference is concluded, at the conference, the facilitator will draft the settlement agreement, as I stated, because you all both will sign it at the conference and not later. So at that point, once it's fully executed, OMHA will combine the appealed claims into one ALJ appeal number, and then we will issue a dismissal order because, of course, per the settlement agreement, you, the appellant, agree to withdraw your request for hearing for the appeals that are pending at OMHA that are subject to the settlement agreement. Likewise, CMS's Medicare Administrative Contractors, or MACs, they are the ones who will effectuate the settlement agreement. So if you have several different MACs who are responsible for all of the claims, you'll receive payment from all of those MACs. And that's pretty common in our agreements, that there are 2 or 3 or even 4 MACs at play, and you'll receive payment from each one. Now, sometimes it does happen, unfortunately, that we have a conference and an agreement is not reached. If that happens, no harm, no foul. You haven't lost anything by participating in SCF. If your appeal was already assigned to an administrative law judge, it will return back to that same judge so that he or she can process your request for hearing, for a hearing and a decision. If the appeal was unassigned, and that means it was not assigned to a judge, it will return to its original place in line for assignment, and that's based on the date the request for hearing was received. So you do not go back to the end of the line and have to wait and start over with this whole process. You will go back in the spot where you were if you had never participated in SCF. So that's really all that I have. This is a very basic review of some of the more important points of SCF. Again, I do encourage you to go to our website. We have just a ton of information on settlement conference facilitation and on the process and on all of the other eligibility requirements that I did not highlight here today. So I really do encourage you to go to our website and review the entirety of the program, and really do consider this pilot for resolving your claims outside of the ALJ process. Thank you.
Great. Thank you so much, Cherise. This has been so helpful. It's a ton of information. One quick question for you. We've got a couple questions that have come in via the chat box. Before we do that, as I think you know, home health, the home health benefit under Medicare can be Part A or Part B, and I know you only covered Part A here, but I'm wondering if you could, sort of at a high level, just explain how the eligibility requirements might be a little bit different for Part B.
Okay, sure. So if you are home health, and I think this also applies to skilled nursing facility as well, sometimes you have appealed claims that are covered under Medicare Part B. In that case, you would, of course, instead of filing the Part A expression of interest, you would file the Part B expression of interest. I think the main difference between Part A and Part B as far as SCF eligibility is the number of claims that have to be at issue and the amount in controversy that has to be at issue. For Part A, you have to have 50 claims eligible for SCF pending at OMHA, and the total amount of all of those claims must be at least $20,000. For Part B, because Part B tends to have smaller, in this case, suppliers, the major difference is that they have to have 20 claims at issue, or at least $10,000 must be in controversy. So it's a lower threshold, and it's not an and threshold, it's an or threshold. 20 claims or $10,000. For Part A, it's 50 claims and $20,000. Is that correct? I think I got that right. Okay.
This is Amanda. I would just add that on our website there are 2 boxes, and so if somebody has, the website directs you to Part A process and a Part B process. So if that's helpful, there's 2 different walkways once you get there.
Great. Very helpful. Thank you. All right, so first question we got here is, it says, on the expression of interest form, it states that the appellant point of contact and representative is applicable. So it uses this term, appellant point of contact and representative is applicable. So the question is, can we assume that the representative would be an attorney? And do you recommend that we, as the appellant, retain an attorney for this process?
Well, I mean, I can't recommend that you do anything. Some appellants have come through this process with attorneys, and some don't. It's completely up to you. If you have an attorney, just let us know, and we will basically communicate through the attorney, not through the provider. But if you do not have an attorney, we just work with you directly. I mean, it's really entirely up to you.
Okay. And then does the appellant contact need to be the CEO or administrator of the agency, or could it be the CFO, the Chief Financial Officer?
It can be anyone who you designate as your appellant point of contact. We do want to stress that we urge, I don't even want to say we require, but it's almost like a requirement, that whoever is going to sign the settlement agreement actually attend the settlement conference, because, again, you do have to sign it on the date of the agreement on the date of the settlement conference. It's entirely up to you, the provider, who you want to be your point of contact. It should be someone who is going to be hands-on and understands appeals and claims and billing and all of that. It does not have to be the person who's going to sign the agreement. However, the person, again, who is going to sign the agreement should attend the settlement conference.
Okay. Right. Got one more question here. Is there no way to participate in the settlement conference facilitation pilot if you are a small agency with under 50 claims?
At this time, that is the requirement. You do have to have at least 50 claims and $20,000 at issue. However, we periodically are reevaluating our eligibility criteria, and at some point, if we think that that's the route to go, we will look into lowering that number. But for now, with Part A, that is where we are.
All right. So, and again, for Part B, it's lower and it's an or. So, you know, you
right.
could have, okay. All right, great.
Exactly.
And then, you know, this question just came in, and I actually had the exact same question. So, so when you're scheduling the settlement conference itself, one question that occurred to me and to one of our viewers today is, where is the settlement conference held? I mean, is it in Falls Church where your offices are? Is it, you know, some central location, or is it more flexible? Tell us how that works.
Well, typically we actually do the settlement conference on the phone. I know for a lot of people who have done settlement conferences that may seem kind of weird, but it works, particularly because we have appellants who are all over the country, and CMS is in Baltimore, and we're in Falls Church. CMS also will only participate via telephone at this point, so usually we just do the settlement conference on a conference call line. Our conference call line actually announces people when they enter and exit, so when we go into private sessions and joint sessions, we know who's on the line, and it does work really well. We have had a couple of appellants come to OMHA in Falls Church, Arlington, depending on which one works better. But when you do an in-person settlement conference, the only group that you're in person with is OMHA, because CMS will only participate on the phone at this point.
Okay, got it. So that's helpful, very helpful. We have another question about the eligibility. So at least on the Part A side, if you have fewer than 50 claims, I'm sorry, so actually, well, I'm just going to read the question as exactly as it reads here. So we have less claims but more than $20,000, I guess, in terms of the value of those claims. So does that mean that we would not be eligible?
That's correct. That provider would be ineligible for SCF because you have to have 50 claims and $20,000. So unfortunately, if you had 30 claims and $50,000, you'd still be ineligible for SCF. That's what the requirement is as of today.
Got it. Are you notified if you are not chosen for an SCF after sending an expression of interest? And then what's the usual time frame?
Yes, I can't, well, let me answer this question in both parts. Yes, you will receive a notice. For example, if CMS declined to participate, you will receive an email from the SCF mailbox. It'll actually be titled Cancellation of Settlement Conference Facilitation Expression of Interest. I'm sorry if you get one of those notices. It's very sad for me to even write them, but unfortunately it does happen. And so you will receive a notice stating that CMS respectfully declined to participate, or perhaps you don't have 50 claims pending. We'll tell you the reason why if that does happen. And I'm sorry, what was the second part of that question? The amount of time.
Yeah.
The time frame. Yeah, at this point, I can't give out any specifics on the time frame because we've had such great interest in the SCF pilot, and we work them in the order in which they're received. So literally just going through each one as they come in. I don't have a time frame for you. We do just ask that appellants be patient. You will receive written notice from us either way. If CMS has agreed to participate, we'll do your spreadsheet. You'll receive that preliminary notification from us. If your expression of interest is canceled, you'll receive a notice that way. You just really have to be patient because of the large amount of the great interest that we received, but also the fact that we have limited resources here at OMHA. We just ask that people be patient and just await the written notice.
Got it. So one question that I have, I mean, you said that sort of the burden is on the appellant to show that they're eligible, to be eligible and show that they're eligible. So let's say that you submit for, I don't know, 51 claims, and you've met the dollar amount for eligibility, and just one of those claims of the 51, it turns out, is not eligible. Would it just proceed with the other 50, or does that one somehow create a flaw that might result in a process issue that would make you start all over again, or how does that work?
Well, if you have 50 claims, you're eligible. So I think you really mean if you have 49 claims.
Well, I guess I purposely picked 51 though because I'm just trying to figure out how flexible you guys are in the process, right? Like if you submitted 51 to begin with, it happens that one of the 51 was flawed in terms of eligibility, so it's ineligible. But you still have 50 remaining that are eligible. Could you still keep going with? Would you guys allow the process to keep going with that remaining 50, or does just having one of the 51 make it so flawed that you got to start over?
No. You would just move forward with your other 50.
Okay.
The only way that the process would stop is if you fall below the 50.
Okay, that's really helpful.
Mm-hmm.
And another question I have, because this is a home health specific audience, and as you know, with home health, we're a part of the healthcare system that has had a lot of issues with claims denials and therefore appeals. I mean, from a process standpoint, from your perspective, having looked at different claims that have come in via this SCF pilot, have you seen any process issues or other issues that you find that are unique to home health?
No, I haven't. Most of the issues I see are more along the lines of providers or suppliers who don't quite understand the SCF process, or are looking for something that this process can't provide. I think something that everyone has to remember is that they need to have realistic expectations coming into this. This is a payment negotiation process. It is not an ALJ hearing. If you're not flexible with how much you're willing to receive from CMS, then you're not going to get a settlement agreement. And by that I mean if you come into this thinking that you should get paid 100% or even 95% or 90%, this probably is not the venue for you. Your claims should probably stay in the ALJ hearing queue. You have to be realistic. This, I tell people just so they can have the right frame of mind, even though this is sort of like a very informal analogy, but we've all bought a car, and we've all gone into the dealership, and you come in with a low number, and the dealer comes in with something incredibly high. And at some point, you want to meet in the middle at a number that you feel comfortable with and the dealer feels comfortable with, and everybody sort of won as far as what the final number is. That's what this process is. If you are looking for 100% payment, if you feel that CMS has perhaps treated you badly and you want to express that, and then that's fine. But, I mean, you really want someone to understand and to make a ruling about bad behavior or something like that. You should keep your appeals in the ALJ hearing process. This is a payment negotiation process. So I would say that really is something that I have seen some appellants, they don't have the right frame of mind coming into this, and unfortunately those are the appellants who usually don't get settlement agreements.
So this is Amanda. I would just like to add a little bit about that. When Cherise is talking about being realistic, I think it also has to do if a provider took a little time to review their relative success, they might have a little more realistic understanding. I think, you know, when people are at conferences and the like, they tend, every provider or supplier I've ever met says that they have a 100% win rate, and that's just not statistically possible based on our ALJ decisions. We don't have a 100% overturn rate of the quick decisions. So it probably depends provider by provider of how selective they are with their appeals. There are some providers out there who just blindly appeal everything. There are others who very carefully review the merits of their respective cases and only appeal those that they believe have the most merit, you know, the most coverage most documentation that would support coverage and have the strongest case. So I think all of that kind of factors in, and there, you know, just from our point of view, there's a wide range of provider and supplier behavior. So it's not, everybody's not painted with the same brush. I would just say just be realistic of your own agency's, you know, documentation and history.
This is really helpful. I've got one more question here. Can you elaborate on the criteria regarding beneficiary liability? It's not clear what that means.
So in your quick reconsideration decision or in your redetermination decision, at the end, usually the last part of the decision will state the beneficiary is not liable, meaning the beneficiary does not have to pay for the amount in controversy. I mean, that's pretty layman's terms of what that means. However, sometimes those decisions will say the quick has found that the beneficiary is responsible for the amount in controversy, meaning the beneficiary has to pay it. There's different legal reasons why that is. You need to look at your decisions for your claims. If it says the beneficiary is liable, meaning that they have to pay, then that appeal is ineligible for SCF. And the reason why is because when a beneficiary is liable, they have a significant interest in the appeal, and we are not doing settlement conferences with beneficiaries and providers and CMS all in one settlement conference. That's better suited for the ALJ hearing process. So you need to just look at your decisions, whether that be, and that means both your quick reconsideration decision and your redetermination decision, and look to see if they held the beneficiary liable or not. It will literally say the beneficiary is held liable. The beneficiary is not liable. The provider is liable. That's what you need to look for.
And in home health cases, I think folks would normally see this when there's been an issue about the ABN, the Advanced Beneficiary Notice. That's when most commonly in home health cases folks would see a liability determination.
Right. I was going to say most likely only if there was some kind of an ABN. So that's good. Okay, that's very, very helpful. So going back to the questions about eligibility and the fact that there probably are a lot of smaller agencies out there that might not be able to meet the $50 claim or $20,000 threshold for eligibility, but on the Part A side. How, over time, and you said, over time you might reconsider the eligibility. Would it be okay if maybe we continued that conversation after you all have had some more experience with the settlement conference facilitation pilot? Because I do think that there are quite a few agencies out there that I think would really like to be able to resolve their appeals early, to maybe help to clear the caseload that you all are under, and just sort of be mutually beneficial for all parties.
Hi, this is Carla. We continue to relook at the success of the program and see different ways in which we could expand, and we would be happy to continue this dialogue to see how we could assist in this process. So.
Okay, that would be terrific. And then, one last question from me, and I think that we're getting pretty close to time here. I know that you've got sort of the, a Part A set of eligibility and then the Part B side. I'm wondering if you're seeing this process used more on the Part A side or the Part B side.
I'm sorry, can you repeat that one more time? You kind of broke up a little bit.
All right. I'm wondering if you're seeing more usage of the SDF pilot for Part A claims versus Part B claims.
Well, since we started with Part B in Phase 1 and Phase 2, of course we have more Part B suppliers who are currently in the process. We just opened Part A in February. But we are seeing a significant amount of Part A expressions of interest. At this point, I would actually say the Part A expressions of interest are outpacing the Part B. I don't have any definitive numbers for you, but there is a healthy interest by Part A providers. And, of course, that includes hospitals and inpatient rehabilitation facilities, home health, hospice, and skilled nursing facilities. So there is a very healthy interest on the Part A side.
That's great. And then one more technical question from me. I think you said that the settlement conferences are typically done by conference call. So if you need the settlement agreement to be signed, on the spot during the settlement conference, I'm just wondering from a basic logistics standpoint, how do you sign? Is it faxed in, or is there some kind of electronic means that you use to get signature on the agreement?
That's really a great question, actually. I wish I had covered it. I didn't even think to discuss that, because that's actually a really good question. Most, as you mentioned, and I stated before, most of the conferences are via telephone. So when there is a settlement agreement, we usually just come off the conference line because the conference has ended, and the facilitator will formally conclude the conference. They will then draft up the agreement, and they pretty much drafted most of it actually prior to the conference, just in case. But they will finalize it, and then they will either fax it to you or email it to you. We would like to email it to everyone. However, we have to use a program called SecureZip. It's a secure program, and unfortunately, a lot of providers' email filters will not accept documents that are secure-zipped from OMHA. So usually, we end up faxing the entire settlement agreement to you. Give you some time. Of course, it has to be signed that day, so you do have a little bit of time to review it. Just make sure it's accurate. The percentage term is correct, and all of that stuff. And then you would sign the last page and just fax back the last page to us. Then we'll send that to CMS. They will sign it, and then we'll have the fully executed agreement. We'll send the whole agreement both to you and CMS via fax, and we'll also mail you a hard copy.
Great. Well, this has been just extremely helpful. We're at the top of the hour, And I know that Judge Moore had to drop off, but I want to just thank Judge Moore, Cherise, Carla, and Amanda for participating today on our webinar. This was a free webinar. We plan on posting the slides on the Alliance website shortly after this webinar. We also recorded the webinar. We'll post the recording of the webinar as soon as it's available. It takes at least a few days, if not a week, to get that up. So I want to thank all of you all as speakers again from OMHA, and we hope to be in touch with you in the future as well so that we can talk about how we can further work together. So thank you again, and I want to thank everybody for participating today and joining on the webinar. Hope everybody has a good afternoon and the rest of your morning. Thanks. Bye-bye.
Thank you.
Thank you.